The calls won't stop for Alicia McGuire and Anthony Carroll, part of a mobile crisis response team in Maryland, who travel in person to the most serious of suicide and crisis calls. When we met, they had just returned from one. The call you just came back from, harrowing, trying, difficult?
Not difficult.
Serious?
Serious.
McGuire and Carroll are busier than ever after the launch of the new 988 Suicide Lifeline number.
This is for our mobile crisis team.
Erica Turner, who runs the Maryland call center, says she's seen a 30% increase in people requesting help since the new 3-digit number launched.
We were able to hire folks, we were able to train them and get them ready for the launch.
But all of that costs money. Turner was aided by tens of millions in new federal grants that accompanied the 988 rollout. But her call center gets a large chunk of its funding from the state of Maryland. So if you were in a state that didn't fund you like Maryland does,
we would be struggling. We would be struggling.
This map from the National Academy for State Health Policy shows less than half of states have enacted legislation to expand funding for the new 988 Lifeline. Pennsylvania is one that hasn't, and it's straining smaller call centers in that state, like the one Julie Dees operates.
So the funding that we're getting right now doesn't even cover the cost of our paid staff, let alone operations, training, that sort of thing.
Still, Miriam Delphin-Rittman, the Assistant Secretary for Mental Health and Substance Abuse, says calls, texts, and online chats are answered on average in 42 seconds. Either by an operator in or near a person's area code or by a backup location. Are you concerned that there could come a time where the federal dollars don't flow the way they are and there are states that aren't funding this and some of these call centers wither?
It's always difficult to predict the future, but certainly what we're having discussions and working on right now is to develop a strong infrastructure.
But smaller call centers are worried if that infrastructure will hold, and Turner is anticipating even more people seeking help as more Americans learn the new number.
We want people to know just 988, just like they know 911.
Jay O'Brien, ABC News, Washington.